Hello guys, Dr. Aguilar again. We're going to talk about hypertension or high blood pressure. This is a very common disease. However, for us cardiologists and functional medicine doctors, it's not exactly a disease itself. It's a consequence of a not healthy vessels in your body. There are so many important and new discoveries about high blood pressure or hypertension that we need to talk about those. But basically what happens is that for the last 40, 50 years, maybe longer than that, we've been treating high blood pressure as a disease, and we've been treating a number. Mainly what the blood pressure cuff tells you the number is, we just want to lower it. And we don't take into account that blood pressure develops from a lack of elasticity to the vessels. So if we were to provide the elasticity back to those vessels, meaning we get them healthy again, then the blood pressure is going to come down by itself, and that'll take care of the whole condition. So for us, functional cardiology, functional cardiovascular diseases, doctors, we like to treat the condition going to the roots of the problems. And what happens is this, as we understand, the vessels inside lining, which we call endothelium, have a problem when they get inflamed. And inflammation for those vessels comes from high blood pressure itself, which comes to perpetuate its own inflammation, toxins, metal toxicity, you name it. But basically comes down to not healthy food. For example, too much sugar in the diet triggers a high insulin. Insulin triggers inflammation, and therefore, sometimes this inflammation makes those little proteins inside the endothelium change in structure to some extent. And then our own body finds out that those are guys that do not recognize any longer. And we, our immune system, can form antibodies against those little proteins in the inside lining of the vessel and makes it stiffer when it starts combating itself. You know, those diseases that we call autoimmune diseases is pretty much the same. We're forming antibodies against our own body. Depends what we're talking about, like the thyroid, the nucleus of the cells, the gut itself, coming up to develop leaky gut syndrome and other like IBS and other diseases. But coming back to the vessel, the problem is that the vessel has lost its elasticity and it's lost the capacity to produce a very key component, very important product, which is nitric oxide. Nitric oxide, it's the most potent vasodilator, meaning it gives back elasticity to the vessels. So if you see someone with high blood pressure, their production of nitric oxide is, pretty low, maybe zero. And the production of other products that make the vessel stiffer is going to be very high. So how can we return the elasticity to the vessel? Basically, we need to make sure that we have a high production of nitric oxide. And there's a diversity of things that you can do. First one is eat a healthy diet. The problem is that healthy diet is not understood very clearly out there. There's a lot of confusion. For the most part, physicians, when we went to med school, we did not have any proper training on nutrition. So a physician in general doesn't know much about nutrition himself or herself. When we go through functional medicine, we have to do nutrition training. Some of us may have a nutrition degree. And that's when you start seeing things in a different way and you try to go down to the roots of the problem. So, healthy nutrition can be explained to you in our clinic. It's very simple. It's very easy to do. And even people that have bad habits can get slowly into the groove of doing a very healthy diet. But the other aspect of it, as we may aid in the help of the elasticity, is some specific supplementation. And we can talk about those later. However, the production of vitamin K2, for example, in your gut by the microbiota, berberine, resveratrol, some of the B components of vitamins folic acid, alpha-lipoic, resveratrol, and many other supplements that can be combined in a single pill can be utilized to try to help in the process of getting back the nitric oxide elevated. Nonetheless, thanks to the work of multiple people, mainly Dr. Nathan Bryan, a good friend of mine, we trained together at Baylor College of Medicine, and he actually is a faculty there. Now you can take a tablet of nitric oxygen, and we would like for you to know that that's available for you in our clinic. Should you want to go that route? Should you care about your blood pressure? And I think all of us should care about our blood pressure. Let's get started, and we can even measure your production of nitric oxide and determine whether you need one thing, another, or several at the same time. But basically, it starts with a healthy nutrition, and that's very simple to do. Until next time, have a wonderful day.